At the same time, Medicare member enrollment now open in all states, and scammers are already eyeing ways to empty wallets. So one top of price hikes and coverage changes. Those enrolling now have to be extra cautious of scams, given a short window to switch plans. The shutdown also disrupting some services. About half of the CMS agency staff is on leave, and new applicants could face processing delays. All of this opening avenues for scammers to exploit. With us now is a spokesperson for the Better Business Bureau, Melanie McGovern. Melanie, thank you for joining us. This is such an important topic, a concern for many. You know, Medicare fraud now reaching new estimates of $100 billion each year. This is directly impacting the fund, those who rely on it as well. What's causing this? Is it a boom in tech?
It's a combination of things. It is uncertainty with the government shutdown of what people are supposed to do. A lot of times it starts with phishing, an email, a phone call. People aren't sure what to do. Scammers exploit that. They take advantage of it. So we always remind people, protect your Medicare number like you would your Social Security number, like you would a credit card number. Don't give it out to anybody on the phone who calls you unsolicited. You know, make sure you're really protecting that, especially during open enrollment.
Well, that's great advice. And I do want to dive into more of the tips that you have for folks who are concerned about this. First, what are the new types of scams your bureau specifically is bracing for? What should people be looking for broadly when we discuss this?
There's always the phishing scam. A lot of times now we're seeing it come via text message instead of email. So it's important to know what you've subscribed to. Some people do get text messages from their health insurance company. So it's important to know what you've subscribed to not give that Medicare number out to just anybody who sends you a text message. You know, be wary when you click on any link in an email. If the website looks just a little bit off, if it doesn't have a .gov in it, if it's not the URL for your health insurance company, you know, be very skeptical. Don't put any personal information in. You know, just any healthy dose of skepticism. That anything that comes to you, a phone call, a text message, an email, you know, make sure you're checking it out before you engage.
Right, and urgency is always key too. You know, if it seems like you have to act right away, that should raise some eyebrows as well. I wanted to ask you about any resources out there that may help people, especially during this time when we have a government shutdown. People are looking for answers. Procedures are changing. Are there resources you feel like are reliable, up to date, where folks can get the right information?
Well, you definitely want to go to the government websites. Those are still up and running. Our website, bbb.org, has great information in our scam tracker tool. If somebody comes across something and they're not sure, hey, is this real? Is this not real? You can put the details into our scam tracker. And if it is a scam, examples of it will pop up. And we also have great information on our website just to protect people with tips and information to know, hey, this might be this might be a scam. This is the way to go. So, you know, definitely using the resources that are out there. You know, it's all free, so people can just go and read it and make sure that they're not falling for a scam. And if they are, you know, they can always report it to us as well. Even if they don't lose money, it's so important to have that information for others who might be searching for the same thing.
Right. Well, it's very important awareness. It impacts a lot of people, and it's a growing industry, unfortunately. Melanie McGovern, great to have you. Thank you.
Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.